Hello everybody, I am Dr. D. Ramesh, Head of Department of Paediatrics and Neonatology, Yashoda Hospital, Hyderabad. Today I am going to talk about a congenital malformation condition called cleft lip and cleft palate. This is one of the congenital malformations where the child has an obvious deformity on the lip, and for the parents and the grandparents to see, it's very shocking. So what exactly is the cause of cleft lip? Cleft lip, 80% of them due to a genetic disorder. It can be generally passed on through generations. The grandfather has cleft lip, the father has, and the child has. The other 20% may be due to maternal causes like maternal abuse of alcohol or maternal smoking or maternal use of some drugs or some medicines which are not agreed during pregnancy. How common is cleft lip? In the world, every 780 or the babies which are born, one of them can have a cleft lip or a cleft palate or combined. And in India, every year we have 35,000 babies who are born with cleft lip or cleft palate. It's so common as that. So what are the normal clinical manifestations? At the time of birth, both cleft lip and palate, if they are together, they can cause severe disturbances in feeding in the newborn baby. The newborn baby cannot latch onto the breast properly because of this thing, especially if the baby has cleft lip on both the sides. And if associated with the cleft palate, not only having difficulty in latching onto this thing, the baby can choke because there is no barrier between the gastrointestinal tract and the respiratory tract. So the expert doctor has to train the mother how to feed the baby. We have a thing called a plastic operator where they insert it into the mouth, which blocks the palate. Sometimes if the operator gets, it becomes irritable for the baby, they cannot use it. Nowadays we got specialized nibbles for these children. They are called spatula nipples or flat nipples, which are very soft and which exactly block the cleft palate, and that has a wide opening with which the baby can feed well. So these are all the things which the mother has to train and manage, because otherwise the growth of the baby will fail. And other than this, the baby should not choke and develop respiratory infections, and the mother should be told about the precautions for this. What is the management? The management initially is, as I already told you, how to give milk to the baby, see that the baby does not get colds and coughs and does not have any choking episodes. But the main management is surgical. So when should the child go for surgical management of the cleft lip, surgical management of the cleft palate? Surgical management of the cleft lip, we use the rule of 10. The rule of 10 is the child has to cross 10 weeks, the child should cross 10 pounds, in kgs it is 4.5 kg, and the child should have a hemoglobin about 10. If all these three tens are there, the cleft lip will be corrected and it will be done by any good plastic surgeon. Whereas cleft palate can be corrected only after the child crosses 10 months, so that there are no speech defects. This is the initial treatment. At the age of 5 years, when the facial growth is finished, sometimes with the cleft palate correction is not proper, a resurgery may have to be done so that the nose and all that will look perfect on the baby. So parents, cleft lip and cleft palate are a congenital malformation which will give bad pain to you, but it can be totally corrected and your baby will be perfectly normal. So please don't worry about it. Thank you.
Like, comment, and subscribe for more health updates.